Welcome to Senator Daphne Campbell, District 38 Healthcare Townhall meeting. To introduce a very special person. She's a graduate of Florida International University with both a bachelor's and a master's degree. She's also a graduate of University of Miami School of Law with a Juris Doctorate degree. She worked as a law clerk, legal intern, a nurse, and many other areas of healthcare. She has served in the community as a member of the FENPAC Board of Trustees, where she participated in the endorsement of Florida elected officials and candidates running for office. Participated in bylaw amendments and conference hearings during an ANN that convention, and even shook the hands of the most powerful man in the world at that time, President Barack Obama. She also served as vice chair of Toastmaster International, a nonprofit organization.
In 2010, she traveled to Haiti to assist in the earthquake relief effort. She previously served as chairperson of the Florida House of Representatives District 108 Health Task Force. In 2010, she was honored with a proclamation by the Miami-Dade County Office of the Mayor and Board of County Commissioners. She is the Chief Executive Officer of Health Management Ventures, Inc., and self-published book author of Higher. She is the first Jamaican-American woman to chair the Health Task Force in both legislative chambers from Miami, South Florida. Ladies and gentlemen, please help me welcome Jennifer Leslie.
Hello, are you ready? Yes. Are you ready for an exciting evening? Yes. Are you ready for an exciting program? Yes. So let's get started. Honorable State Senator Daphne Campbell, dignitaries, Senate District 38, Citizen Advisory President and Board members, Senate District 38, Health Task Force members, all constituents of District 38, and all members of the audience here tonight, good evening.
Good evening.
We're all gathered here tonight for one reason and one reason only, and that is for your dear, Honorable Senator Daphne Campbell. We're here together for a special healthcare town hall meeting, which has been organized by your senator. Let's start with Betty Charles.
Good afternoon. My name is Betty Charles, and I'm a healthcare lawyer. I practice in Broward County, and I'm the co-chair of the Legislative Committee on the Healthcare Task Force.
Hello. Next, Mr. George Bossous.
Thank you. My name is George Bossous. I'm the Executive Director and founder of Word in Action. This is an organization that deals with prevention and treatment of children that have been sexually abused. I am the co-chair of the Health Task Force. Thank you.
Next, Dr. Alejandro Arrieta.
Hello, my name is Alejandro Arrieta. I work at Florida International University. I work as a professor there. And I'm an economist, a health economist.
Next, Marjorie Paul.
Good afternoon, everyone. My name is Marjorie Paul. I'm a nurse practitioner. I am one of the vice chair of the Senate District 38 Health Task Force. and I'm also a member of the Haitian American Nurses Association, so I'm here to serve.
We'll next hear from Dr. Katherin Ntekim.
My name is Dr. Katherin Ntekim. I'm a nurse practitioner. I am the co-chair for the Health Task Force. Thank you.
Next, Ms. Shala Tella.
My name is Shala Tella. I'm a pharmacist by profession and I own an independent pharmacy.
Good evening, everyone. My name is Mikkel Titus. I am a public health professional. I am the executive director of the Community Health and Empowerment Network. I also work with Senator Campbell on the District 38 Health Task Force as an honorary member.
Now, just look at what Senator Daphne Campbell has put together, folks. Look at what she has put together. And do you want to hear more? We have more on this side. So let's start on the right with Dr. Pierre Paul Cadet.
I'm actually the adjunct professor at the university. I'm sorry. I'm a medical director of the not too far from you, Max Health Center on 125th, and also I'm a medical director of an office of Polyclinic de West Palm Beach in West Palm Beach and Delray Beach, the past president of the Haitian Medical Association abroad, IMHE, and I'm currently also an ambassador of the Faculty of Medicine and Pharmacy in Haiti, and also adjunct professor at the USAT, University of Science and Technology. I'm also responsible for the foreign, relations for Daphne. That means I'm responsible for all as a liaison between Haiti and Senator Campbell, and also Jamaica everywhere. Thank you.
Thank you very much. Next, Yinka Obajimi.
Good afternoon. My name is Yinka Obajimi Apolari. I'm a nurse practitioner, and I'm also part of the Healthcare Task for District 38 Research Committee. I'm also a nurse practitioner. It's my pleasure.
I know that you've seen the faces of the other two, but you really don't know who they are. Would you like to know who they are? All right. Next.
Good evening, ladies and gentlemen. My name is Dr. Norman White. I am a therapist. I wear many hats. As you can see, I'm here on this panel. I'm a vice chair of the JET. It's Jobs, Economics, and Tourism for the Honorable Daphne Campbell. I'm a member of the AACC, which is the American Association of Christian Counselors. And I sit on many different boards. You could go on and on and on. But it's an honor to be here. Thank you.
Thank you, Dr. White. Next, Mercedes Alvarez.
Good evening. Hi, I am Mercedes Alvarez. I am director of an international nonprofit organization in charge of educating people about their human rights. The name is Youth for Human Rights and United for Human Rights. Thank you.
Now, I just told you that our dear Honorable Senator Daphne Campbell has put this wonderful team together with varied skill sets. Do you all agree that she's very passionate about healthcare? Look what she's doing in the healthcare community. She has put us all together, and she has put our team to work. And later, you will hear about all the wonderful work that we are all doing as a team in the community. Now, as a testament, just to show what Senator Daphne Campbell is doing, and just to show that you really feel that way, please take that flyer in front of you, the one that says Senator Daphne Campbell Cares. I want everybody to stand up with it. If you do not have one, we have some at the front. I want everyone to stand up, hold it up. I have mine, so you're going to hold it up just like this. Now we're going to have the cameraman in front so that he can see. 1, 2, 3. Senator Daphne Campbell Cares. Senator Daphne Campbell Cares. Oh, wait a minute. Okay, we're going to go again one more time. On the count of 3. 1, 2, 3. Senator Daphne Campbell Cares. Okay, thank you very much. That was much better. But our own Michaela Durant Titus, please welcome her to the stage.
Michaela Titus is the founder, CEO, and Executive Director of the Community Health and Empowerment Network. The Community Health and Empowerment Network, Inc., CHE Network, is a non-profit organization established in 2015 with the aim of providing charitable empowerment and health education services to the underserved and low-income population to address health disparities in South Florida. CHE Network offers educational courses to help the underserved populations develop healthier habits and lifestyles. They seek to collaborate with individuals, corporations, and organizations to continue educational programs. CHEN provides assistance to support other small community-based organizations in the network to help them maintain their services in the community through technical assistance and capacity building. So give a warm welcome to Ms. Titus.
Good evening, everyone. Good evening. I would like to say good evening to our distinguished guest, Senator Campbell. As Jennifer mentioned, who's doing a wonderful job in our community. It is an honor and a pleasure to work with her and to serve our great District 38. Tonight, what I'm going to talk about is in regards to the services that we provide. I am the Executive Director of the Community Health and Empowerment Network. I'm also the CEO and founder of this organization. After working with the Florida Department of Health in Miami-Dade County for about 10 years as a STD health manager, as well as the Minority AIDS Coordinator, I basically took a leap of faith to be able to go out into the community and to establish an organization that can help to deal with some of the health disparities that we have going on today. Have you heard of someone that has HIV/AIDS? Now, if some of you do not know what HIV is, it's a human immunodeficiency virus. It's a preventable disease. It's 100% preventable. And it is transmitted through sexual contact, mother to mother, and also through intra-IV drug using. So a lot of you may say, okay, I don't do any as far as drugs, and I don't have a lot of partners, right? But it only takes that one time. And many contacts come across in monogamous relationships, right? And so basically, our goal is to be able to provide education to empower individuals to take control of their sexual health, to use methods such as condoms, right? To be able to protect yourself. Because if there's a disease that's 100% preventable, why is Miami-Dade County right now #1 in the nation for new HIV cases? So there's some work still needs to be done. there's a lot of education, and there's a lot of services that's needed to be able to empower individuals to know that they can take the charge to protect themselves. So I hope I didn't scare you guys too much tonight, but it is the truth. It is what's going on in our community. And in order for us to help reduce, get to zero, which is a goal, 0 new infections, 0 cases of death-related HIV cases, and 0 stigma and discrimination. So I thank you tonight for your time, and please reach out to me if you're interested in collaborating for any services or wanting to get tested for any of the diseases that I mentioned. Thank you very much.
Please give Michaela a big applause.
Lydia Teller began her career as a registered pharmacist with Walgreens in 2004. She became a consultant pharmacist in 2014, 5 years after co-founding Rise and Shine Pharmacists. A devout Christian, mother, and outstanding homemaker, Mrs. Teller is passionate about people's wellness and well-being. She was named by the City of Miami Gardens as a Woman of Distinction in 2012.
Good evening. According to a research done by Harvard School of Medical School, in America is the most expensive, more expensive than anywhere on the planet Earth. So if we spend this much on healthcare, how can we be in health crisis? One would expect that having spent so much, we should have the best healthcare in the whole world. But it is not so. And why is this not so? Because a high percentage of people still don't have access to full health care. Sometimes people are covered by the insurance, but because they have to pay so much when they go to see the doctor, they have high deductible, they have high copay when they go to the pharmacy to pick their medications. All these factors make it difficult for them to have full and complete access to their health. And we know as human beings, our health is the most valuable asset that we can have. If you don't have your health, nothing else matters. If you have your health, you have every other thing. So tonight, I'm going to be speaking from the point, I'm going to be talking about 2 points as a pharmacist and also a owner of an independent pharmacy. I would say from my work experience and interaction with people, I identified 2 major problems that we have that has contributed and is still contributing to the healthcare crisis that we have right now. And the first one is the insurance company. And the second one is the cost of medication.
Thank you so much for your pharmaceutical perspectives of healthcare. She is right. Do you all agree that we do have a healthcare crisis in this country? How many people agree? Please put your hands up.
Good evening. You're all looking so wonderful. We appreciate your presence here, and Senator Daphne Campbell surely does appreciate your presence here. We did a few research about the community health perspective. We decided to present this to you because we need for you to know why the Senator is passionate about your health, and we thank you for giving us the opportunity to talk to you and to share with you our research. And I'm going to let my Vice Chair also talk to you about the different things that she has also found from the research that we conducted.
Marjorie.
Good evening, ladies and gentlemen. Bonsoir. Buenas tardes. Good. On behalf of our Honorable Senator Daphne Campbell, I want to say a warm welcome to all of you for being here tonight. I'm sure you have, there's a lot that you can learn. Moi vraiment content pour moi nous tous qui venons à soir là et me souhaiter que nous apprendre quelque chose dans cette présentation ça que nous allons faire. M'a parler de anglais à créole parce que my Spanish is not that good, so un poquito Spanish. Okay. Now, we want to talk a little bit about Medicaid expansion. As you know, now, under the leadership of our new president, I'm not sure we're going to have a Medicaid expansion. Now, Medicaid expansion is not likely to get through, and that is the honest truth. We have a governor, and we have the Senate and the House of Representatives that are more Republicans. So therefore, the likelihood of them actually come together and cut and actually expand Medicaid so that more of you can have Medicaid is actually very, very slim to none. So therefore, this is going to affect the district. It's going to affect you from getting access to care. So therefore, I need you guys to actually be more involved. Be involved in the community. Let your voice be heard. Raise awareness, and try to stand up for what is right, which is the right to have healthcare access. Thank you so much.
Bonsoir, that's the only word I know in Creole. Buenas tardes, I know a lot of words in Spanish. Well, let me tell you something. Senator Campbell have a brilliant idea of creating a task force to know what is going on in the community. You know, what are the needs that the community have in terms of health? So everybody knows that, you know, we are afraid of being sick because then we need to pay and it costs a lot of money. Most of you don't have insurance. Most of you have not visited a doctor. I heard one person who, the last time he visited a doctor was when he was born. That happened, right? I mean, you haven't been being a doctor or visit a doctor for years. So when you get sick, you don't know what to do, you will go to the emergency of a hospital, and that is creating a lot of problems for you. So everybody have fears on being sick. So Senator Campbell created this task force to know what happened in the community. And here, you know, we are collecting a lot of information. We are getting data, right? We are doing research, all that boring stuff, right? But we are mostly listening.
Please give these brilliant and highly educated members of the Health Task Force a huge applause. Next, Mr. George Bossous will come and talk a little about mental health. Very important topic.
I am not Mr. Bossous. Mr. Bossous graduated with a Master's of Science in Psychology from Barry University. He underwent a 3-year postgraduate training in the field of infant mental health from the Institute for Child and Family Health, Incorporated, formerly known as Children's Psychiatric Center. He has been working as a psychotherapist and a clinician for over 10 years. He is currently pursuing a doctorate degree in public health from Walden University. Welcome, Mr. Bossous.
Good evening. It's a pleasure for me to be here, and I want to thank Senator Campbell for putting such a wonderful task force together, and I'm very proud to be part of it. Today, we would like to address two specific issues related to mental health care. We'll talk about one, mental health, mental illness bias, and two, access to mental health care. Let's start with the first one. Although mental illness bias could be found across the board, however, it was recently reported that even mental health professionals might not be immune from hidden biases regarding mental illnesses. For instance, Marjorie reported that accuracy of diagnosis was affected by the social identity of both. According to the U.S. Department of Health and Human Services, 1 in 5 American adults have experienced a mental health issue, and 1 in 25 Americans live with a serious mental illness, such as schizophrenia, bipolar disorder, and major depression. In terms of access to mental health care, the Haitian American community is in great disadvantage in comparison to other communities. Not only the number of Haitian-led mental health agencies is low, but also there is a major lack of funding allotted to mental health care in this community.
Ladies and gentlemen, please give Mr. George Bossous a hand. Miss Pierre, where are you? She likes to tell everybody that she's a nurse and that she's very passionate, very educated, strong businesswoman. Please come to the stage. Good evening, ladies and gentlemen. Bonsoir. Bonsoir. Côté moun qui vle sucre sous bonbon là. Je voulais prendre l'opportunité ça pour remercier sénateur nous, Daphne Campbell, pour le programme ça que nous mettez sous pied pour nous. Pour qui care pour la communauté en pile, qui care pour la santé nous. Et sous notre ça, m'a invité sénateur Daphne Campbell pour avancer, pour monter cette pour nous. All right. That's a good one. All right. Bonsoir. Good evening. Good evening. Buenas noches. Ah, no, I'm parle tout langue. M'ngi chame za tout chong chong chong. Oh, on va comme ça. M'ngi africain tout oui. Ouais. Dr. Taylor, stand up. How do you say good evening in Africa or in Nigerian? It's not wait. How you said it?
You want to know that?
Yes.
No,
Dr. Taylor, please stand up, say it again, because I just want to learn it tonight. Come on. We all want to learn how you say good evening in Nigeria.
You guys are ready?
Yes. Sénateur dans tout le monde, moi dans Nigérien, moi dans Africain, moi dans Spanish, moi dans Jamaïcain, moi dans Haïtien, moi dans tout. Je fais que ça passer en bill, ça gagne 2 mois, côté que Konya là, dans state Floride là, son loi liée. 1er janvier, qui indépendance de pour nous, the national holiday. « 18 mai, fête drapeau noir, national holiday. Soit l'année prochaine, si vous n'avez pas ni l'école, ni travail. Nous pas camper, non l'école, non travail, n'a chita la caille nous, n'a bon manger, hein, bon manger. Qui a problème caille? Tout le monde? On ne peut pas voler. Qui monde qui m'a nous? That's why, c'est ça. So nous disons moi, mère, c'est pour Heritage Month, National Holiday.